The maternal mortality rate, or the rate of pregnancy-related deaths, is rising in the U.S., and heart disease is actually the leading cause. So experts at St. Luke's and UMKC are on a mission to help solve this crisis through a new nationwide study. And joining us now is Dr. John Spertus, Clinical Director of Outcomes Research at St. Luke's Mid-America Heart Institute and the founder and director of UMKC's Healthcare Institute for Innovations in Quality. Dr. John, thank you so much for taking time to talk with us today.
Thank you so much for the opportunity.
Absolutely. All right, let's dive in. Kind of talk to me about the impact that heart disease can actually have on pregnancy.
Yeah, as you mentioned in the opening, the United States should be really and is embarrassed about the fact that it has 3 times the maternal mortality rate of any other industrialized nation in the world. And we're the only industrialized nation whose rate of maternal mortality is rising. And we have disparities that no other country really has. And it turns out that heart disease is present in about 2 to 3% of pregnancies, and yet it accounts for 1/3 of the deaths. And we have very little information to understand the risk of individual patients who have different types of heart disease, or how best to treat or organize the care for treating pregnant people with heart disease. And that's what this grant is seeking to help address.
Well, you are actually the principal investigator on the HOPE study for mom and baby. So what exactly will you and your colleagues kind of be looking at in the study?
Yeah, so with, my colleagues, Karen Florio and Anna Grodzinski, we've been able to engage 35 cardio-OB clinics or centers throughout the entire United States. And our goal is to enroll 1,000 pregnant people with heart disease and track very carefully their risk factors as soon as they present with their pregnancy, but also how they're treated, the baby's outcomes, and adverse pregnancy outcomes through an entire year after delivery. And it's really the first ever study to take such a detailed exploration of the risks, care, and outcomes of pregnant people with heart disease.
What do you guys really hope to accomplish or even just change upon the conclusion of the study?
So we've been very fortunate to have a strong collaboration with other organizations such as the Preeclampsia Foundation, the March of Dimes, the Association of Black Cardiologists, who are all committed to trying to improve the care and outcomes of pregnant people in general, but particularly high-risk pregnancies. And so they're working with us so that when we learn the best way to define the risk of patients or how best to treat patients according to the risk, and more importantly, how do we even organize care to provide the best care for pregnant people with heart disease, they're going to have early insight into those discoveries. And then we'll work very closely with them to try and disseminate our learnings throughout the entire country to maximize the impact this can have on the care and the outcomes of pregnant people and their babies.
Well, it's amazing what you guys are trying to do with this research. So can you tell us actually a little bit about the National Institutes of Health grant that's actually making this research possible?
Yeah, we were very fortunate to get funding from the National Heart, Lung, and Blood Institute, which is a division of the NIH, or the National Institutes of Health. The whole country is really struggling how to address this crisis in maternal care in the U.S. And, as part of that, it requires fundamental scientific and clinical inquiry to learn how best to reorganize the way we deliver care. And that's the mission of the NIH, is to provide and support that fundamental research. And so they're very invested in this and have been tremendous partners with us in navigating through the bureaucracy of governmental funding to help us launch this study. And it was just awarded last week, and we're just so excited to have this opportunity to make an impact.
Well, you can learn more about how St. Luke's and UMKC are working together to combat country's rising maternal mortality rate by visiting stlukeskc.org/hope-study.